it's your turn to be the voting associate. And so I presume that's okay with you?
That's fine, Bill.
Very good. Thank you. So with that, I guess would jump right into tonight's agenda, which is an update from Cheryl.
Hi, good evening, everybody. So it has been a busy week. The governor is in anticipation of phase 2, which is projected to begin next week. He's released guidelines for reopening. Those reopenings include outdoor dining, amateur sports and adult sports, and retail. This was released to all facilities, so they have ample time to prepare for the opening. The executive order preparing for phase 2 reopening has to be compliant with all COVID-19 workplace safety rules. There's a couple others are planned to be opened in a step 2 of phase 2. So more to come on that. Funeral homes are now allowed 40% capacity, or they will be as of phase 2, and pools and day camps will be allowed to be open. That's all I have. Again, that's mostly, just to reiterate, that's in preparation of phase 2 reopening. We actually reached out to our restaurants this week, and we're being inundated right now. So we sent them an email and gave them all the guidance that they need on Monday, I think it was. And so they're all working frantically now to try to abide by these regulations that take effect on Monday.
Could you please fill us in? I think you've also had some exciting developments this week.
Hi, Bill. It's nice to see you all again. So there have been some changes. I'll give you the quick update about Acton itself. So right now we have 170 positive or now presumed patients within the town of Acton. This has changed a little bit since the new guidance came out and the new reporting came out this week, that the state is adding probable cases to their case report numbers. So we've had to do that all along, as we've been treating them as a positive, the probable cases, and those are specifically the serology patients, which we talked about last week. So there is new guidance on that, and I will go through that. Currently, there's 32 in isolation within the town, 117 have recovered, and then, of course, unfortunately, 21 fatalities, which that number has stayed at that for quite a while, which is good news to us, at least, and I'm sure to everyone else. So just a couple things, the guidance on the serology that we had the last couple of meetings discussing, the DPH guidance and in sending an enforcement letter that was voted on by the board last week. We did have 4 residents at last week's meeting that I mentioned who were either ignoring calls or the initial informational isolation letter that we send as a Department of Public Health that we spoke about at the last meeting. 2 of those folks, so at the last meeting we talked about sending 4 letters. 2 of the folks would have ended at the end of the day on Thursday. They were well into what would have been their isolation period. One resident who had received a letter with the isolation guidance did call us on Thursday and complied with the testing recommendation by the state. So they went for the molecular PCR test and came off of isolation. And then the letter was the last we could not still get a hold of. So the letter was delivered and the resident called and agreed to isolate. And we got the additional contacts, which there were 5 direct contacts who were identified in the town of Acton on top of that. So, that was great, that the board allowed us to start sending those letters for anyone who is not responding or complying with the self-isolation order, so that we can at least, give them the state's directive to self-isolate by that order. And then, the process, if the process goes on from there, then it goes to other people than me. Let's just say it like that. So that was good news. Congregate living, I wanted to mention the Benchmark, the Inn at Robbinsbrook. They've been 12 days without any new cases, which is great news. And Life Care Center of Acton, also good news. They've been 19 days without any new symptoms or positive cases. So that is really, really good news. I did have a question this week about the Department of Developmental Services, any of the group homes in town. We do have one, and we have not received any information related to a employee or a resident within that home that has tested positive. So that's also good news. I know someone on the board has asked me about that in the past. So that's good news. Let's see. So just back to the antibody testing. And I apologize. I just completely told you the wrong thing. The person that complied was the person that was sent the letter, but he also had the PCR test that was positive. So this resident that wasn't isolating, I apologize. I just read my own notes wrong. The person who wasn't complying was sent the letter. He had the test done and he was PCR positive. So he was actively diagnosed with coronavirus after he had the positive serology. I believe from what my coworker who is dealing with this resident discussed was that when the testing was done, there was a miscommunication, I believe, on what actual test was being done. The resident has a challenge with the English language, and I don't think there was an interpreter who was doing the testing. That was sort of the issue in speaking with family. And the resident didn't understand what the test was for, that it was a serology test as opposed to a diagnostic test, which most people wouldn't know that anyways, honestly, because people just go to get a test and they're doing, what needs to be done. So there was, a little bit of a miscommunication on the testing level. So this resident did go for the PCR test and was positive. So it was good that we sent that letter. So just on the antibody and the antibody testing, the serology testing that's being done, there was new guidance that came out today, which we knew eventually that would happen. And the guidance now for serology, as a public health department, we still call people to interview them. And based on their answers, it could go one of two ways. So if someone has a positive serology test, antibody test, and they've either have never had a diagnostic PCR or antigen test, or previously had one that was negative, what we're doing is we're asking them if they are symptomatic currently, or have they been symptomatic in the past 14 days, and or if they were ever symptomatic. And based on those answers, if the person has symptoms, if the person doesn't have symptoms and never had symptoms, we don't have to go any further. This, we tell them, thank you for, doing this, et cetera, and we close the case. If the person does have symptoms within the last 14 days, or they had symptoms that they can say to you, as an example, they used on the call. I'm sorry, it was yesterday. My days are running together. If they say to you, I know that I had the symptoms of COVID-19 around, let's say St. Patrick's Day, since it was in March, it kind of jumps out. This was the example they gave. We still obviously call them, interview them. Based on their answers, do one of two things. If they have symptoms in the last 14 days, we do have to isolate them, and they should consider pursuing the PCR testing. And again, if it's negative, then they can discontinue isolation. But if they aren't symptomatic in the past 14 days, and they can give us that information for data collecting, that they had symptoms a month and a half ago, and they had a fever, they had the specific symptoms of COVID. So and how they define that with this is either a cough or shortness of breath, or at least two of the following. And they have the list of fever, chills, shaking, chills, headache, myalgia, sore throat, new loss of taste or sense of smell. So if they have any of these, and they can say absolutely that they've had it, we document that as to collect that data, so that we have that information on each of these patients. So that's good news that they're updating that. As time goes by, as things happen within the state, as the CDC changes its guidance, it's good news that that's happening. Let me just look at my notes. The only other thing I wanted to mention was also the governor, when the governor spoke today, they did announce that they're putting some additional new fields into their reporting. The number of individuals that have recovered, which I think that is great news, because that's very helpful to people to see that, that people are recovering from this, and they're not just passing away and having fatalities, which is great. They're also adding the number of inpatient and outpatient psychiatric cases of COVID-19. And then they're also including the nursing facility audits, which is good news, and then, good information for people to know. The other point that was mentioned on the call today, on the governor's call today, was that they are starting visits in phase 2. There isn't a date; it's to be determined, for visitation to congregate settings. So, of course, with particular guidelines in place. I haven't read the whole thing, but what I jotted down when I was listening was that family visitations would be limited to 2 individuals with social distancing. Face masks will be worn. And a long-term care employee or other employee, if it's at a assisted living, one employee will have to be with the resident during the visit. My assumption would be to make sure that the 6-foot distance is happening. And they will be doing visitor screenings, asking people to self-identify if they've been sick, if they've taken their temperature today. So they'll do those typical screenings that we're seeing, that started in the beginning, and that they've been doing with healthcare workers going into, say, an assisted living. They do that type of screening. And the main thing is the schedule. The visits have to be scheduled, and they have to be outdoors. So it is good news. Thankfully, it is summer, and people can start seeing their relatives that are in a congregate setting, which I think is wonderful news for everyone all around. So that, I think, is my update. Thank you.
Well, thank you very much, Heather, and thank you for all you've been doing for these many months. Just in terms of board feedback for our own purpose, what I think I heard you say, and I'd like to make sure I'm getting this correct, is that in fact the concern about a positive serology test actually resulting in a person who was positive on a PCR test, and then, i.e., being infectious, um, sort of validates the thinking that a person with a positive serology test, should be treated as infectious until proven otherwise. Is that what I kind of heard? Because we actually experienced a case where that was exactly true.
Yes, yeah, that's exactly what happened. The new guidance that I just mentioned, and this, is brand new as of yesterday. That if someone who had a serology test done is symptomatic in the past 14 days, which this resident had been, then it absolutely applies. The isolation guideline does apply to that. So that is what you had heard.
Okay. And then the other thing I think I heard was that, in fact, in one of the cases where we had a positive PCR test, in other words, the person was, um, you know, uh, diagnosed with COVID as well as being um, potentially infectious or symptomatic, that the delivery of the Board of Health letter actually did prod action, whereas it may not have been. What do I want to say, nefarious, or that's not quite the right word, but it may not have been um, you know, wrong on their part. It was a misunderstanding, but that the letter actually prompted action, which was the outcome desired. Is that sort of what I
Yes,
heard?
absolutely. Yes, it was. Yep.
Okay, so just for the board's feedback, I think those are good data points to understand going forward how we might approach. I'm sure new and more challenging situations that we may be presented with, but thank you very much. I have I have no questions, like I say, other than to just thank you for all of the support you've been doing, and I hope at some point we all are granted a little bit of reprieve from COVID stress. But
Sure. My pleasure.
thank you. So then, at this point, I'd ask: do any members of the board have questions for either the health director or the nursing director? Mr. Cruz, I saw you on mute first.
I did unmute. Can you hear me, Bill?
I can.
Oh, great. My question is for Heather. I'm wondering if the nursing service has the capability of taking the swabs or blood draws for to send to a lab for testing.
So as of now, the public health departments have not been asked to do either of those things. We did talk at the last meeting about if there is eventually a vaccine. Is that something that we could do? And I talked about how we did our initial pandemic planning for mass vaccination at the transfer station, and that had been done for quite a few years, which I think will still work nicely when that day does come. For testing and serology, that would really depend on what the state will end up doing. The swabbing, I would say yes. If we were asked to do that, that's definitely something that we would look into, and potentially, what pops into my head is doing it similarly to the mass vaccination at the transfer station. The location, you can drive around the building. You don't have to be inside. We can put tents up. So that would be a possibility. The serology, we don't have access to the supplies that you would need for that and the refrigeration. So that would be my only, that would be my hesitation comment about that at this point. I don't know if we're ever going to be asked to do that, but it's definitely something to keep in the back of our minds.
Thank you, Heather.
Okay, thank you.
Thank you.
I did see Joanne also unmute and Dr. Jacoby, but I think Joanne was a little bit ahead. So please go ahead.
I pulled the trigger. Good evening.
Yes,
Thank
you
you,
did.
Heather. I always find your updates very informative, so I appreciate your efforts. I had a question about the newest guidelines on how to interpret how many positive cases are presumed positive. Can you explain a little more about that and how it changed, if at all, Acton's numbers?
So Acton's numbers would not have changed dramatically because as a public health nurse, we were told that anyone coming through with a serology positive testing, we would count those as a positive COVID-19 case. So that won't change. What the state is doing now is the probable cases that historically came through from March 1st, and any of the deaths that were presumed to be where there wasn't testing done for COVID-19 after the death of a resident of Massachusetts, and they were, by symptoms, they were considering it presumed COVID-19. Those numbers have been expanded. So that's the new reporting that the state is doing. Since as a public health department, we had to count those cases, the presumptive positive cases for serology positive tests as a positive case. I've been counting that all along, and that's what we were guided to do as a local board of health.
Okay, terrific. Thank you.
Thanks, Joanne.
Bill? You're on mute, Bill.
Thank you. Sorry. Dr. Jacoby, did you have a question for either Cheryl or
Yes.
Heather?
Yes,
Please go ahead.
I had a question for Heather. Heather, out of the 32 that are in isolation, how many are in the community versus the congregate environments?
So currently, the congregate environment is, let me just think. I didn't write that number down. Hold on just a second. I believe right now in the community, if I'm calculating this right in my head, we have 12 residents who we are following in the residential community, and the rest, so 20, are still in congregate settings who are in isolation. But most of those should be coming off soon as time has gone on.
So if nothing changes within a week or two, there'll be none in the community setting. Is that right?
Correct. If we continue, if we go forward with no positive cases on a daily basis, that number will just keep dropping. It'll really depend on if there's, additional positive cases that come through. And that number doesn't include anybody that's on quarantine, just to put that out there. That doesn't include quarantine residents in the community.
Okay. Thank you very much.
Thank you. Mr. Conaby, do you have a question?
Yes, thank you, Heather, for all your work. We really appreciate the updates and all your efforts and your staff. Now, getting back to and following up on that last question, there have been a significant number of cases in the community, positive cases that have been isolated in quarantine. Is that correct? Because there's been some discussion that that's all in the congregate settings, and I just wanted you to clarify that so people hear.
Oh, sure. We've had 170 cases overall. 63 were in life care, 10 were in benchmark, which is the Inn at Robbinsbrook, and the rest were in the community. And those are isolated. So those are folks on isolation. The quarantine cases, which are contacts of positive cases who never ended up converting to a positive case themselves. As of today, I think we have about 133 that have been under quarantine. I don't know the exact number off the top of my head who are still in quarantine, meaning they're a contact case. They're not a positive case, but they do have to, follow the guidelines of quarantining for 14 days.
All right, thank you.
Sure.
All right, thank you. Any other questions from members of the board for either Heather or Cheryl? All right, hearing none. Cheryl, do we have anyone from the public who wishes to ask a question or make a comment?
No, I don't have any.
Very good. Well, then, thank you, everyone. I appreciate the update. It sounds like, we've navigated some tricky waters here and have come through reasonably okay without any undue negative impact. So that's very good. And thank you very much to the staff for bringing that about. So in that case, let's turn our attention to the next agenda item, which is the discussion of the athletic fields. I believe, Cheryl, you've got we finally got pinned the state down to giving us some relatively concrete guidance, and then we can, as a board, consider how we wish to act on that.
Right. So I was starting to sweat that out a little bit, but we did finally receive it. As I indicated at the previous meetings that we had, it was, I've seen or heard in conference call bits and pieces of information. And so finally now we have some information in writing from the state that says that athletic fields can be open if they follow the specific safety and reopening standards for parks, open space, and outdoor education programs. And also they don't have to be from the same household. So in your packet tonight, there is a lot of information. So the other thing that the board had asked at one of the last meetings was to get some plans from people. So it's kind of similar to what we're doing for the restaurants at this point. We're asking anybody that wants to follow these guidelines to submit their plan to us. So in your packet tonight, you'll see quite a few plans. I think I have one from Acton Dance, Acton Softball, Revolution Yoga, and CrossFit. So these people are all looking to do programming outside. Because as you know, I think it's phase 3 for most of them for a reopening indoors. So I've included those in your packet. And then there's also in your packet, there's a modified order. I don't know, David, if you can pull that up, just so we can take a look at it. But that order is basically lifting the board's order, the previous order that we did back when this all started, to not allow the use of athletic fields. So we're looking to modify that order that was previously issued by the board and allow the reopening of the athletic fields with all, the COVID face covering order and the guidance that I spoke to from the Commonwealth of Mass regarding reopening standards for parks and open space. So, and some of those conditions are they can't, no contact sports, no shared equipment, no group gatherings, and basically this order is only for people involving 10 or fewer people. So that's all in the document that's in front of you right now. And I'd be looking for board input to open those fields.
Okay, thank you, Cheryl. So at this time, I guess it would be appropriate to ask for comments from members of the board. How do members feel about uh, approving this modified order? Mr. Conaby.
Yep. I guess at this point, we've had a lot of conflicting information from the state, but it seems at this point that now we have at least in writing what we're allowed to do. It's generally in line with the guidance they give, with a few exceptions. But at this point, with the good trends and hopefully a lot of good luck, this seems to be the prudent next step. I think Cheryl had asked about this, so it was kind of a revised order similar to the last one. And I think the last point to make on it is that it really is similar to all the other things we've done. When you're doing this, you still have the face covering, social distances, and limitations on the number of congregants or people gathering at the spaces and using it. And I think they need to have time for the department to review the plans to make sure they're all in compliance and to plan for a proper, safe reopening. So it seems like it's a good, prudent next step, and I think it's allowed, so we should probably try to go forward with this in a step manner as we've done everything else, and see how it goes, and hopefully it'll go well, and everyone will be able to do more things outside and enjoy the summer.
Excellent. Thank you, Mark. Ms. Becerra, I believe you were going to make a comment as well.
I just had a question. Just in general, I agree with Mark. I think this is a good next step. We seem to be on a downward trend with our local cases. Again, provided everybody complies with the masks and the social distancing. When I read this to my daughter the other night, because she's been asking about athletic fields, and I, got to the no shared equipment piece, she's like, well, what about balls? So my sense is a ball is a shared equipment, but I just wanted to, wondering like how do we define shared equipment? Things like tennis rackets and bats and lacrosse sticks and all that, obviously, but how nitty gritty do we get, and do we need to be specific in any kind of signage or instructions we give to the public?
Good question.
Yeah. So, did you want me to speak to that?
Yes, please.
So, I don't really have an exact answer, but Mark did raise a good point that I should have mentioned. These, even though the board may vote this to reopen the fields tonight, there's still some work to be done prior to opening. So, like with NARA, you voted to allow that to open. It took us almost a week to get one portion open and another week to get another portion open. So I would expect the same thing with this. I can get clarification on the ball. What I will say though is tennis is clearly allowed, right? And they are sharing a ball. So I can make sure before before we allow the openings that the signage reflects the correct answer to that.
Okay, thank you, Cheryl. Joanne, go ahead.
I was just going to say thank you. You beat me to it.
All right. Any other comments or questions? Mr. Cruz.
Hi. Yeah, it seems like every day I open up both the Massachusetts dashboard for COVID as well as the Broad Institute, and it is very encouraging to see the downward trend in positive cases. I think Broad Institute had 1 or 2% the past couple days. That's good. What I worry about though is if opening things up and seeing this rise again. So for me, I would hate to open too prematurely on this. A lot of the items I think make sense though, as far as face covering, social distancing, and limitations on gatherings. But over the course of the shutdown of these fields, I've personally witnessed, kids out there essentially not following the rules. So I'm just wondering who's enforcing these requirements.
Well, I mean, Cheryl could speak to that in just a second, but I'll just make the general comment, Mike. I mean, there's a lot of reliance on people's integrity on this in this process. For example, the biggest one: you have symptoms of COVID, you get a test, you're told you need to stay at home for 14 days, self isolate for 14 days, and the people say, "Sure, I'll do that." Um, I've also had experience with the cases where that isn't actually what happens, and you just have to hope that the vast majority of the cases it is, and that they are compliant. But there's going to be leakage, and I know you know that, Mike. But so we try to nudge, cajole, and otherwise encourage compliant and proper behavior, but sometimes it's a struggle. But
Yeah,
Cheryl, you can.
yeah.
Sorry, go.
Thanks, Bill. I figured, Cheryl, I'm guessing you'll probably say it's similar answer to Bill, but I just wanted to. I have a feeling that the board probably will adopt this tonight or the next meeting, but I would just caution, maybe we're going a little bit too fast, and we should keep an eye on the data. And if we start seeing an upward trend in any of the metrics on the state of Massachusetts dashboard, that we try to act quickly to clamp down again.
Very good point. I mean, yes, we're trying to follow the state's guidance. They're clearly looking at the data as well. But you're right. If the cases suddenly blossom again, we're going to have to